Hello, and welcome to the Vams end-to-end demonstration. I will now introduce the training team. Today, you'll have myself, Lindsay Stewart, Jenna Rowland, GR Duloc, Shelby Keller, and Matt Menz reviewing the Vams end-to-end workflow. I will now turn it over to my colleague, Jenna, who will begin with a review of the end-to-end Vams workflow. Jenna?
Thanks, Lindsay. This workflow shows how the Vams portals and their users interact with each other. There are a series of activities that each user will engage in that will trigger or allow an action on the part of another Vams user. For example, the first step for everyone to begin using Vams begins with the jurisdiction POC adding clinics and organizations in Vams in order for them to activate and register their accounts. This allows clinic points of contact, which will likely be the clinic administrators, to set up their clinic operating hours, vaccination stations, place inventory requests, and add other clinic users in Vams so they are prepared to administer COVID-19 vaccination to recipients. This also allows employer coordinators to register their organization in Vams and either add employees in the system or request the jurisdiction POC or point of contact to authorize policy-enabled registration. Detailed information about policy-enabled registration, or PER, is available in the user manuals. After the employer coordinators have added their workers in Vams, they become vaccine recipients and receive a registration email prompting them to complete the pre-screener, add their medical information in the system, and then schedule an appointment at one of the vaccination clinics. When the vaccine recipient arrives at the clinic, a healthcare professional will administer vaccine. Now that we've reviewed the Vams workflow, let's get started with our end-to-end demo. Okay. Today, I will be serving as JJ, the jurisdiction POC for the state of Michigan. As a jurisdiction POC, I was added in Vams by CDC and received a registration email from vams@cdc.gov. So the first thing I want to do as a jurisdiction POC is to start adding clinics and organizations or employers into Vams so they can register themselves in the system. Again, this will allow clinic administrators or POCs to set up their clinics in Vams and allow employer coordinators of organizations to add their critical infrastructure workers in Vams so they can then register as vaccine recipients. As you can see, the Manage Clinics page is a landing page for the jurisdiction portal. From the Manage Clinics page, I can add clinics by clicking this button in the upper right-hand corner, as well as search for clinics that have already been added in the system by clicking the View All link at the bottom of the My Clinic table. So I'm going to click that. And from here, I can use this search box to search for via name, point of contact, email, or status. Or I can sort them by clicking these arrows, which will alphabetize them. You'll notice that all of these columns are mostly self-explanatory. The status column, however, indicates if the clinic administrator or POC that you've added has registered their clinic in Vams. So if they have, you will see a status of active. If not, you will see a status of pending clinic admin registration. The third status you may see is deactivated, if a clinic administrator or yourself has deactivated the clinic in the system. So let's go back to the clinic portal homepage, the jurisdiction portal homepage, where we can add a clinic. So today, I'm going to be adding Bever Road Clinic. The first name, last name, primary, phone, and email are all required as indicated by a red asterisk. So today we will be adding Austin Rowe, who is the clinic administrator for Bever Road Clinic. Okay. So here you will see that there are certain fields that are required as indicated by the red asterisks and others that are not. First, we will enter the name of the clinic. Then we will select the clinic type. So today we will just simply be clicking clinic as this is a standard clinic. However, details about these other options can be found in the user manuals. You can add a provider PIN or an IIS facility ID, but that is not required. The primary clinic address is required, and we will enter that. They are in Dalton, Michigan. The shipping address is also required, which can be different than the clinic's primary address if they wish to have inventory delivered to a different address. Okay, and as you'll notice, you will see this button down here called Back to State Portal. You can click on that at any time to return to the portal homepage, but note that if you do, none of the information that you would have entered thus far will be saved in the system. You may also click the previous button to return to that first page if you would like to make any edits. For now, everything looks good, and we're going to click Next. So this page shows a review of all of the information that you have added for this clinic. I'm going to take a look. Everything looks great. So I'm going to click Next. Okay, great. So now the Bever Road Clinic has been created in the system and has a pending clinic admin registration status that will be noted in that column that we just viewed on the clinic on the portal homepage. So we will see that we've entered Bever Road Clinic, and it is pending clinic administration registration. Now, let's go to Manage Organizations. This page allows you to add organizations or employers in your jurisdiction. Again, adding an organization in Vams will allow their employer coordinators to add critical infrastructure workers in Vams. I want to pause here to address how we use the terms employer and organization interchangeably. In Vams, an organization is an institution, association, company, or other group that will add critical infrastructure workers and other at-risk groups in Vams to be considered for COVID-19 vaccination. An employer is an example of an organization. We use the term employer coordinator to indicate the person within an organization who will be serving as the point of contact for the jurisdiction and will be adding workers into Vams. The functionality of this page is the same as Manage Clinic page, as in I can add organizations, or I can also search for them by clicking the View All tab down here. The difference is I have two options to add organizations. I can either add, or I can import an organization list, or I can add an organization one by one. I won't be demoing the import functionality today, as it will be demoed in the employer coordinator role later in this demo. So I'm going to click Add Organization. You will see that adding an organization in Vams is very similar to adding a clinic. So for this one, we're going to be adding Matt Mins, who is our employer coordinator for this new organization. This organization's name is IIS Healthcare Workers. And you'll notice here there's an organization category. There are several to choose from. Just choose the one that you feel is most appropriate. Notice that you can also enter an organization's address and city, but it is not required. However, the state is, they are in Michigan, and their zip code is 49345. They can also have a phone number, a website, and an email address associated with them as well. You'll notice this category is the organization authorized for policy-enabled registration. We won't be demoing this functionality, but again, you can find detailed information about policy-enabled registration in the user manuals. For today, we're going to click No. So we will review all of the information that I've entered for this organization. Everything looks good, so I'll click Next. Great. So now this organization has been added in Vams. The employer coordinator will now receive an email with a registration link for them to click on to register their organization in Vams. So I'm going to click the logo to return to the Jurisdiction Portal homepage. The next tab we will review is Inventory Requests. Here's where you will see all of the inventory requests in your jurisdiction that have been submitted by clinics. These requests can be submitted by the clinic's administrator as well as the inventory manager. You can click the inventory request number to access the request record. As you can see here, there are details about the request, such as who requested it, their clinic address, what was requested, which product, how many doses, when it was requested, the date, and the date that they are requesting they receive the doses by. Over here on the right side of the page, you will find the chatter functionality. You can share an update with the requester by typing in a note here. So we will note that vaccine shortages will require a lower shipment for this clinic, and then we will click Share. So now the requester can go into their inventory request on their end in the clinic portal, and they will see this note that I've written. If you want to be notified via email when they respond, or if they respond, you can click this Follow button. And now, when someone responds to this post, you'll receive an email. So I'll click the logo to return to the portal homepage. The final page we will visit during this demo is the help page. You will find a link to the help page in the upper right-hand corner of the portal homepage. Here you will find frequently asked questions users may have about their role or activities while logged into their portal in Vams. All users have access to the help page. You can scroll through these jurisdiction FAQs, or you can search by them by entering a topic in this field, and then clicking on the frequently asked questions knowledge article. One item that is unique to the jurisdiction POC portal is the submit a question functionality. No other users have this functionality. If you can't find what you're looking for, you can select a category of your question, type in a question, and click Submit. After you've clicked Submit, a response to your question will be sent to you via email from vamshelp@cdc.gov. Once you receive a response to your question, you can communicate back and forth with the support team by replying to that email. This concludes my demo of the jurisdiction POC. I'll now turn it over to GR, who will demo the role of clinic administrator point of contact.
Thanks so much, Jenna. So let me start now by sharing my screen. As a clinic administrator, you can use Vams for several tasks: defining and managing your clinic's information, such as location and operating hours, adding clinic staff as Vams users, placing and tracking inventory requests, logging vaccine inventory and waste, monitoring inventory levels, and communicating with your jurisdiction about inventory requests. To get things started, the first step you will take to set up your clinic in Vams is to activate your user account in the system. And once you've activated your user account in Vams, you'll be taken to the Vaccination Clinic registration page. So to get things going, we see that we've received an email from Vams. Hello, Austin Rowe, you've been identified as the point of contact for the Beaver Road Clinic. Please activate your clinic user within Vams by accessing the following link. So we're going to go here to go to our Vams portal. And we can now see that it tells us, "Hi, Austin, welcome to Vams. Please create your account to access the clinic module." Now we see here that our username has already been pre-populated in the system with our email that the jurisdiction POC provided. So now all we need to do is go ahead and set up a password. So we'll do that right now. We'll create our password. And then other than that, if we go back and check our email, we should see that we have received a verification code. And sure enough, Vams has sent us an email to verify our email address for Vams account creation. Within this email, we can see that we've received a verification code. I can go ahead and copy that over, making sure I'm just copying over those numbers, placing the verification code in here. Let's read over the security alert, just making sure we agree with it all. And since we do, by checking this box, I agree to the specified terms, and we can go ahead and create our account. All right, now our account's been created in Vams, and we can go ahead and start getting things going for the Beaver Road Clinic. First off, in our Register Vaccination Clinic module, we can see that we have our clinic point of contact, and we can just go through and make sure all of our information is correct. And if we need to change anything, we can go ahead and edit it right now. Since everything looks good, we're going to go ahead and click Next. Now the clinics, here we can see the clinic's information here. We can see we have our clinic name, clinic type, as well as our provider PIN, primary phone, and email if we chose to enter in that information. Just a quick note that only fields marked with a red asterisk are required in Vams. We keep scrolling down further. We can see our clinic primary address entered by the jurisdiction POC is present. All of the information appears to look correct, so we can go ahead and keep going down. We now see that we have our clinic shipping address. We can see that that is also populated from what the jurisdiction POC entered in for us. Since those addresses are the same for us, everything looks good, and we can go ahead and click Next. Finally, let's go ahead and review all of our information. Just double checking, making sure everything looks good. If it doesn't look good and there's anything we need to edit or change, we can go ahead and click Previous. But since the information does look good, we're going to check the box confirming the information is accurate, and then click Next. All right, so now our clinic is active in Vams. We can go ahead and click the View Portal button to be taken to the Clinic Portal home screen. For the purpose of today's end-to-end demo, we'll be going through the system in order of tabs on the screen, which may be slightly different than the order clinics actually go through when initially setting up their clinic. Because of that, first up to cover within the Clinic Portal is the Inventory Management tab. Here, let's talk about how to log COVID-19 vaccine inventory. When you receive a COVID-19 vaccine delivery, you can log it into Vams in one of two ways. You can use a 2D barcode scanner to scan the barcodes on the vaccine vials, which will automatically enter the information in Vams, or you can manually enter the information with the Manually Log Inventory button. First, let's talk about the 2D scanners. Vams is compatible with 2D barcode scanners, including those that are both wired and wireless. However, it's important to point out that integrated mobile device scanning, such as an app that can scan a 2D barcode, will not connect with or transfer information to Vams. To begin logging inventory with a 2D barcode scanner, you must scan and log each unit of sale or UOS individually. Each unit of sale contains multiple vials or unit of uses, otherwise known as UOUs. When logging inventory, you must scan one unit of use from a unit of sale. So on our Clinic Portal homepage here, we're going to go ahead and click Scan Inventory. When the Scan Inventory pop-up appears, what we would do is we would scan the UOS barcode with our barcode scanner, choose the manufacturer, and go ahead and click Next to have all of that information pre-populate for us. However, in our case, since we do not have a 2D barcode scanner on hand, we're going to click back to Portal, and we're going to go through the Manually Log Inventory process. So to do that, we're going to click the Manually Log Inventory button. And from here, we're going to first select our manufacturer. Then we are going to select the product that the manufacturer has available, in this case, the COVID B vaccine. And then we're going to fill out the rest of the required information. And for our total vials that we are requesting, we are going to say 100. And for the expiration date, we're going to set that a year out from today's date. Note that when you're putting in this information for the real vaccine, you should be following what is ever on the package in front of you. After we filled out all the information, we can go ahead and click Next. We can see that we can review the inventory we just logged manually, making sure that all of the information looks correct. It looks good to me. And so what we can do is go ahead and click Next. We can see that our inventory has been successfully logged and the total on-hand inventory for the clinic has been updated. Let's go ahead and click Finish. So here, back on our inventory management homepage, we can monitor inventory levels and view snapshots of available and booked appointments. The inventory management page gives you a complete view of important information about your vaccine inventory level. We receive a snapshot of the number of appointments available at our clinic over the next 28 days, the number of appointments booked at our clinic, as well as the number of total on-hand inventory doses. Note that when we enter the count of 100 when we log the inventory, the total on-hand inventory shows as 200 doses. This is because when the vaccine was entered into Vams behind the scenes, the vaccine was entered as requiring 2 doses to complete the series. So Vams is going to go ahead and do that calculation for us. Now, let's say that one of the units of sale happens to break as we are transporting it to storage. Similar to how you log vaccine inventory, you can log vaccine waste in Vams in 2 different ways, by using a 2D barcode scanner or manually logging waste. So since we do not have a 2D barcode scanner, we'll cover how to log waste manually. Again, this is going to cover the same information as the 2D scanner functionality, but we will input the fields one by one. To log waste manually, click the manually log waste button on the inventory management page. Here, we're going to go ahead and enter in the information that we need to do. We're going to select our manufacturer. We're going to select the product. We're going to put in the lot vial number, which we can choose from the dropdown. And we can see that the expiration date is automatically pre-populated for us based upon what we put in when we log the inventory into the system. For the reason for the wastage, we have a few options provided to us in the dropdown, as well as an other option if none of these are applicable to the situation. In our case, we're going to say we have a broken vial syringe, and the number of doses wasted is 10. From here, we'll go ahead and click Next. We can go ahead and review all of our information, ensuring it's correct. Since it does look good, we're going to go ahead and click Next, and we can see that the total on-hand inventory for the clinic has been updated. Because of that, let's go ahead and click Finish, and I'll take us back to our inventory management homepage. We can see here that if we look at the bottom of this dashboard, we have our COVID-19 on-hand inventory totals, and we can see here that we received 200 doses, but we have 190 doses remaining because of the inventory that we had broken. We can also see that reflected up here in our total on-hand inventory reporting screen as well. So now that that's covered, the next tab in the system is the Inventory Request tab. Here, you can place, view, and track inventory requests on this tab. The Inventory Request page shows you a list of all inventory requests you've submitted. This list includes a system-generated inventory request number, clinic name, product type requested, date requested and required, number of doses requested, and the status of the inventory request. As we can see, since this is a new clinic, there are currently no requests in the system. But to place a request, we can go ahead and click the New button on the upper right-hand corner of the inventory request table. The site inventory request pop-up window will appear. And from here, we can go ahead, we can search for our product. We can put in the number of doses that we're requesting. We're going to go ahead and say 200. Our clinic automatically populates for us. Now let's go ahead, and for the date requested, we're going to go ahead and put in today's date. For the date required by, we're going to say 1 week in advance, so on the 10th. From here, we can see our status automatically populates as submitted, and we're going to go ahead and click Save. So here we can see for our COVID-19 inventory request, where there was no request before, we now have 1 request here. So after our request has been sent, a record of the request is going to appear right there in our table. The inventory request record gives you important details about the inventory request and allows you to monitor the request and communicate with the jurisdiction POC. So what we can do is go ahead and click on the inventory request link to access the inventory request record. Here, we can see the inventory request details on the left and a way to chat with the jurisdiction POC on the right. So here's all of the information that we already entered in when we just put in our request a few seconds ago. And if we want to communicate with the jurisdiction about anything that is going on with our request, what we can do is we can go ahead and click share and update. Say this is an update for the jurisdiction and go ahead and click share. So like you would on a social media platform, click the follow button at the top of the page here in order to receive email notifications when the jurisdiction POC responds to our post. Note that we must make a post to be following it. Clicking the follow button without posting will not allow you to follow whatever messages are posted otherwise. So that wraps up our tabs regarding inventory. Now let's take a look at how to manage users. First, let's go back to the portal. Adding clinic staff and managing their user status in Vams gives them access to perform their role in the system. The clinic user roles should generally align with each user's existing scope of responsibility at the clinic. So as a clinic administrator, you can assign multiple user roles to one user, giving them access to perform additional tasks in Vams. Prior to assigning multiple roles to clinic staff, it is important to be familiar with Vams roles and the activity matrix in your clinic administrator user manual. If you hadn't had a chance to review the user manual yet, I highly recommend taking a chance to look at it now before proceeding further. So to add Vams users for your clinic, we're going to go ahead and click the Manage Users tab on the Clinic Portal homepage. And then what we can do, we can see that we are already the first clinic user within our clinic, but we want to add more users to this. So what we're going to go ahead and do is click the New button. Here in the Add or Update User pop-up window, what we're going to do is enter in our user's email of whoever we want to add into the system. And from there, we are going to go ahead and click Search. So we are going to add one of our healthcare practitioners into the system. So we are going to add in our email for them and click Search. And what we can see is that our doctor, Tyrone Williams, is already in the system. We know that because we can see that the information has been pre-populated after we put in the email address. We can see that the information for that he is pre-populated from what he is in the other clinic as well too. So we can see that we've selected the healthcare professional role for him already. However, if we do want to make Tyrone to have multiple roles within the system, we can use these arrows here to add roles, as well as use them to take them away in case we don't actually want them to have another role within Vams. We can see we can also select a list of credentials available for the user we're adding to the system. In Tyrone's case, he is a medical doctor, so we are going to go and give him the MD credentials, and we're going to go ahead and click Save. After clicking Save, we can, if Tyrone wasn't already in the system, a registration email would be sent to him to allow him to set up his account in Vams. But because he is already in the system, he will just be able to log in and see this appear as an option for him after his Vams login. Now, you can also edit a Vams user's record or remove them from the system on the Manage Users page. So to edit a user's information, what we can do is go ahead and click on their name. And from here, what we can do is go ahead and click the Edit button. We can see we can update information, we can update the roles available for it, as well as update their credentials. Essentially everything that we would have done in adding in a new user. From here, we don't want to change anything, so we're going to go ahead and click Cancel, and we can go ahead and click Back, and then that'll take us right back to our Manage Users homepage. Okay, so now let's cover the remaining tabs around clinic setup. From the Clinic Details tab, you can click the Edit button above the clinic's name to update your shipping address for inventory, set and change the duration of clinic appointments, or deactivate your clinic. So we're going to go ahead and click that Edit button and see what we can do. First, you can use this tab to update your shipping address for inventory. As a reminder, the clinic shipping address can be different from the physical address if you prefer the vaccine to be shipped to another location. So if we wanted to change the shipping address, we can do so by editing right in this box. Next, you can use this to begin setting up the clinic operating hours. However, we're going to go back to this in just a second. Third and final thing you can do within this tab is you can deactivate the clinic. Click the Deactivate Clinic button in the bottom right corner of the page to bring up the Deactivate Clinic pop-up window. It'll ask us to confirm if we wish to deactivate the clinic, and it'll tell us the number of total booked appointments as well as the number of vaccines in our clinic inventory. So deactivating this clinic will eliminate future appointments and cancel all booked appointments already in the system. Since we do not want to do this, we're going to go ahead and click Cancel. So now we can see what we have to do in order to set up a clinic schedule. You'll set the duration of appointments at your clinic, operating hours for the clinic, as well as add vaccination stations and set their operating hours. First, you can set the duration of appointments for your clinic in Vams for 10, 15, 20, or 30 minutes. To select an appointment duration, we're just going to go ahead and click on the duration that we want. In our case for today, let's say we want it to be 20 minutes. But we're going to go ahead and select that, and then we're just going to go ahead and click Save. This will set the appointment duration for all of the vaccination stations we'll add in Vams. So now let's go to the Clinic Setup tab to keep on moving through the process. So we can click the Setup Operating Name and Operations Hours linked under the clinic operating hours at the bottom of the page. First, we need to go in to our clinic, and then what we can do is review the information here. We can see that the clinic is available for scheduling. If we want it to not be available for scheduling, we would click the Edit button and uncheck that box right there. But since we want to go ahead and start setting up some clinic schedules, we are going to keep that checked. And now it's time to go ahead and set up those operating hours. So as I said before, we're going to click on the link where it says Set up Operating Name and Operating Hours. So here we can go ahead and name our clinic's operating hours by clicking the Edit button. So the operating name, what we are going to do is, let's say this is going to be the Monday through Wednesday operating hours. And we can go ahead and click Save. So since we have the operating hours name set, let's actually set the operating hours themselves. We see that we currently have 0 time slots, so we can go ahead and click New. That'll bring up our new clinic operating time slots pop-up window. For our clinic operating hours, we're going to say again, it's the Monday through Wednesday operation hours. For the day of the week, we're going to start off with Monday. We're going to say our beginning time of this is going to be 9 a.m. And then our end time is going to be 5 p.m. From there, we can go ahead and click Save and New, and we can continue doing this for the other days of the week. So here we can go ahead, we can click Day of the Week. In our case, let's say Tuesday. For the start time, we're going to go ahead and put in 9 a.m. But on Tuesdays, we actually do not have as many healthcare practitioners as we do on Monday. So what we're going to do is require our healthcare practitioners to take a lunch break. In order to do this, what we can do is set these operating hours to be 9 to 12 p.m. on Tuesday. We can go ahead and click Save and Add New. That'll bring up another window. We can go back to Tuesday. And then from there, we already set up the hours to be at 9 a.m. to 12 p.m. Here, let's go ahead and select 1 p.m. as our start time, and then 5 p.m. as our end time. From there, we can go ahead and click Save, and now we've created some operating hours for our clinic for Monday and Tuesday. So that is how we go ahead and set up our operating hours. So now we need to go ahead and set appointment slots that will be available at our clinic. Currently, vaccination stations are called treatment stations in Vams, so we're going to use that term in this demo. You'll create a treatment station in Vams for each vaccination station in your clinic. No appointments will show as available to recipients until we set at least 1 treatment station. The number of treatment stations and their operating hours affect appointment availability at the clinic. you can set unique operating hours for each treatment station, or once you have created operating hours for one treatment station, you can select and use those same operating hours for other stations. So to create a treatment station in Vams, we are going to go ahead and click on our Vams home logo here and go to our treatment stations tab. From here, what we're going to do is go ahead and click the new button. We're going to select our clinic name as the clinic. For the station name, we are going to set it as station 1. The start date is going to be today's date. And let's have this run all the way through the month of December. Now, for the station operating hours, we can see that we don't have any operating hours currently set. In order to do this properly, we need to go and select the new station operating hours in the station operating hours field. Note that if we create multiple treatment stations, we'll be able to select new station operating hours for each station, or you can select the same operating hours you've created for other stations. Here, let's provide the standing operating hours names. We're just going to say treatment 1 operating hours, then go ahead and click save. And we'll be taken to that treatment station's details page in order to set the operating hours. Go ahead and select our treatment 1 operating hours. Oh, sorry, we clicked new, and now we can go ahead and set them up. So we can go for a day of the week. We select Monday. For our start time, let's set it up to be 9 a.m. all the way through 5 p.m. And then go ahead and click save. Now we have our Monday operating hours, but since we've also added hours for Tuesday for our clinic normally, let's go ahead and set them up for Tuesday as well too. So for the day of the week, we're going to select Tuesday. For the time, we are going to select 9 a.m. through 12 p.m. There, we are going to go ahead and click save and new. And then for Tuesday, we are also going to add in operating hours from 1 p.m. and end them at 5 p.m. And then we can go ahead and click save. So we can do this for as many treatment stations as we'd like to add in Vams. They can all have the same operating hours we've created for the one station, or each station can have their own operating hours. So now that we've set up our treatment station, let's go ahead and click back on our Vams logo to take us to our home page. And from there, let's take a look at our finals tab, Clinic Absences. If you need to temporarily close your clinic, you can create a clinic absence to put a temporary pause on your normally scheduled operating hours. During a clinic absence, the system will show your clinic is closed and appointments will not be available to recipients. If you create a clinic absence during a time when recipients have already scheduled appointments, the appointments will be canceled and recipients will receive a cancellation notification via their preferred communication method. So now that we're on the Clinic Absences tab, what we can go ahead and do is click the new button in the upper right-hand corner. In the pop-up window, we can go ahead and select our clinic's name within the field. For the absence name, we are going to say this is Thanksgiving. The absence reason is federal holiday. For the start date, we are going to say this is on Thursday, and the end date is also going to be Thursday, the 26th, and we can go ahead and click save. So as a reminder, if we create this clinic absence during a time when recipients have scheduled their appointments, the appointments will be canceled and the recipients will receive a cancellation notification. So we receive this warning right here telling us that the recipients will be asked to reschedule. We'll go ahead and click OK. We can go ahead and click save one more time, and we will see that our clinic absence has been populated in our clinic absence table. So a clinic absence will override any operating hours associated with treatment stations, but you might need to set a temporary treatment station absence because of insufficient staff or inventory. So setting a treatment station absence is similar to creating a clinic absence. Let's go back to the treatment stations tab here, and we can see if we click on our station, station 1, we have our station details, and we also have our second tab for station absences. So we can see that we currently have no absences set up. We can go ahead and select new. For our stations, it'll show all of our stations we have. We're going to choose station 1, absence reason. We can say that because we are just standing up this clinic that we currently have insufficient inventory to really start seeing patients or to see vaccination recipients right away. From here in our date field, we're going to say it's for today's date, and the time is going to be just for the morning. Let's go ahead and say 9 a.m. And then we are also going to end that on today's date at noon because we are going to have all of our inventory we need by the afternoon. So we'll go ahead and click save. We get our warning saying that this update will cancel scheduled appointments and recipients will be asked to reschedule. We'll go ahead and click OK. Click save one more time, and then we can see that our station absence has been set. So now this covers all of the tabs within the clinic portal for the clinic administrator. Now I'll turn it over to Matt, who will demo the role of the employer coordinator.
Thanks, JR. As you can see here, I'm displaying the email that I received when the jurisdiction registered my organization. It states that my organization has been identified as a critical infrastructure group by my state. This means my employees are eligible for COVID-19 vaccination. I will click on the link in the email. From here, I follow the steps for setting up my account by first creating my password. As mentioned, we have two-factor authentication. So the verification code is sent to my email. From there, I can copy and paste it into Vams. I then check the box to agree to the specified terms and click Create Account. After creating my password and verifying my email, I can continue to set up my account. From here, I can review the information that was provided by the state and make updates if needed. Here it has my first name, last name, and email address, and all of this is correct, so I can review and click Next. Here I can review my organization information that was also entered by the jurisdiction. If there's any information that is incorrect, I can change it now. All this information is correct, so again, I can click Next. Now I can do one final review of all of my information, go to the bottom, select the box that I confirm it is all accurate, and click Next. At this point, my account is created in Vams and I can access the organization and employer portal. Once I'm in the organization and employer portal, I can add employees to my organization. My essential role in Vams is to add employees and get them vaccinated. I will now click Finish to enter into the employer portal. To add an employee individually, I simply click Add Employee, enter first name, last name, and email address, then click Save. For our example, we will be entering Kim Butler. I've entered the information and then I click Save. This will then give me a message that I've successfully added said employee to my organization in Vams. Now, when I click Finish and come back to the home screen, I can see the employee I added in My Employees tab. Another option is for me to bulk upload employees so I don't have to add them one by one. To do this, I can click Import Employees and can download the Excel template. The Excel template has fields for first name, last name, and email address. It's important to note that this file must be saved as a CSV UTF-8 file. I can use this method for up to 9,999 employees. If needed, I can upload multiple files and review those uploads on the Employee Imports tab. I have already created an Excel doc for this demonstration, so I will now upload that file to Vams. Once complete, you should see a success message at the top of the screen. I can then click Close. I can also, once my upload is complete, I can view the uploaded employees on the My Employees tab. They are not here yet because they are still being uploaded by the system. I can also view the import itself on the Employee Imports tab here. If you click on an employee import, you can download and review the result log to view which employees were successfully imported. Here's an example of the employee import screen, and then here is an example of the result log for a bulk upload. That concludes the employer portal. Before we move forward, I want to call out some important notes on the employer portal. Employers cannot view the vaccination status of their employees. They can only see the list of employees they've uploaded in the system. If an employer uses the policy-enabled registration, they will only have one link for all their employees to use instead of each employee receiving a personalized link. Jurisdictions cannot see the list of employees for each organization. They can get aggregate reports based on doses administered in their jurisdiction, but they cannot see individual organization employee lists. Now I'll turn it over to Shelby, who will demo the role of recipient and then front desk.
Thanks, Matt. So I'm going to walk through the recipient portal, but before we get there, I'm actually going to start in my recipient's email. So since Matt just added me as an employee, I received a Vams registration email telling me my employer has identified me as a critical worker and I've been selected for immunization. So I'm going to click this registration link in my email. And this takes me to the pre-screening questions. I do want to note that these current screening questions are placeholders and they will be updated once vaccine is actually available. But for now, I'm going to say I do not already have a Vams account, I don't have antibodies, and I don't have a confirmed COVID diagnosis. Then I can enter my address, selecting my state as Michigan, and I'm going to say Wayne County and complete the reCAPTCHA. And then I'll click next. Then it takes me to the page to create my password according to these parameters established. I'm going to do that. And then I will need to go back to my email to check for this two-factor authentication verification code. So if I go here, I see that I got that email, so I can copy this code and paste it in. Then check the box that I agree to these terms outlined above and click Create Account. So now my account has been created, but I will need to input my personal, medical, and organization information in order to finish my account registration. So my first name, last name, and username, which is my email, you'll notice are already pre-populated and I cannot edit them. This is because this is how my employer added them into the system. So if you have an issue with any of these, you'll need to please contact your employer. All other fields marked with this red asterisk are required. So I'm going to select female for my gender. I'm going to input a date of birth here. Let's go with that. And then I'm going to select my ethnicity. For race, you have multiple options here that you can select. Choose the one or ones that apply and click this arrow to move them over to your selected options. If you make a mistake and need to move one back, just select it and move it back. Well, right now it's not letting me because I need one selected, but that will work if you select multiples. So I'm going to put in my address now since that is also required. We will say we are in Detroit, Michigan. And entering my zip code. United States is going to be the default country. Home phone is not required, but a cell phone is. So I'm going to put that in. And then I need to select my preferred method of communication. So email is the default. However, I can change this to SMS or text message if I'd like to do so. No matter which option you choose, you can unsubscribe or opt out of notifications at any time, but be aware that doing so will prevent you from receiving any notifications, including your appointment reminders. You can also add an emergency contact name and number down here if you'd like, and then click next. Now I'm asked to complete my medical history. Since I answered female for my gender, I see these first two questions regarding pregnancy and nursing. If I had selected male, I would not see these questions. I'm going to say no to those until living in a nursing home, then indicate any known allergies or select none, and the same for any known existing conditions. Then there are these free-form text fields here where I can list any medications or any other relevant medical information that the healthcare professional should know. But for now, I'm going to leave those blank and just click next. Insurance is an optional field unless required by your employer, so I'm going to skip it for this demo, but just know that you do have the option to input any insurance. So if I click next, we're on to our organization information. So again, my organization is already pre-populated since I was added by that organization. However, I can add my role and select a critical infrastructure group if I would like to do so. There's also an option here with this add organization button to add up to 2 more organizations that I work for if I would like. Going to leave all of that as is for now and continue. Now we have our review page. So just take a look over this, make sure everything is correct, everything is answered accurately and filled in, and then check the box here saying that I agree that everything is correct, and then I'll click finish. This notification lets me know my account has been registered and I'm all set up to go. So I can either view the portal or schedule a vaccination appointment. And I'm going to go ahead and just schedule my appointment right now. So when you're scheduling your appointment, you can search by a full address or just a zip code. So for now, I'm going to search by a zip code. And then I can select a radius within 5 to 100 miles to search for a clinic within that radius of that zip code. Then I'll click search. You'll see here that I get a map view as well as a list view. So when I select a clinic, it will highlight it on the map and give me their address as well as their operating hours and their location. And I can make sure that all that is set and that's the clinic I want. And then the next button will appear once I have selected a clinic. So I can go ahead and click that. Then I have the option to choose my date and time. So today's date is automatically selected, but I could select another date on this calendar if I wish. That will change the day here, and then I will just choose an open time slot. Anything that's shown is open and available. So I'm going to select a time for later today and click next. Here's just the review page to make sure the location, the date and time, and everything looks correct. And then I can click submit. And this brings me to my appointment confirmation page. So this will also be sent to me via my preferred communication method. So now I can click to return portal. And since my appointment is within the next 24 hours, since I happen to make it for the same day, I see this action required to complete my vaccine consent survey for my upcoming appointment. This will also be sent to me via my preferred communication method. So again, this only shows up within the 24 hours of your appointment, but this does need to be completed before you can check in for your appointment. I can also see my appointments table here, and you can see my appointment status is scheduled for today at 3:45 at the Jefferson Vaccination Clinic. If I click view appointment, then I see the details that we just saw on my appointment confirmation. And I also have the option here to cancel the appointment if needed. So I'm going to go back to the portal. And since my appointment is later today, I'm going to go ahead and complete my consent form. So I'm going to click this link. It's asking if I'm currently sick. I'm going to say no. You'll notice that the known allergies are already selected based on what I chose during registration. However, I can change that if anything has changed, and it will update in my medical history, and the healthcare professionals will see that update. You can see the additional questions here for today's demo. I'm just going to go ahead and say no to all of these questions, but please review them and answer them as needed. If you do say yes to any of these questions, the system will alert the healthcare professional just to review your chart and make sure that you are still eligible to receive the vaccine. If you had any other vaccinations in the past 4 weeks, you can go ahead and list those here as well. Then you'll need to click this box to say that you acknowledge that you've received a copy of this privacy practices, and then click next. Now I see this confirmation that my form has been submitted and I'm all set to get my vaccine. So I'm going to just click finish. And once I do receive my first dose of my vaccine, I will have a notification up here with my vaccination certificate that I can click to download as a PDF. And I will also have an alert up here telling me the next available date for my next dose. So the system will not allow me to schedule that next appointment until it's actually time for my next dose. But I can do all that in this system, and I will also receive those notifications via my preferred contact method. So now I'm going to log out as the recipient and instead log in to the clinic portal as a front desk personnel. Enter my email and password. I've already registered as front desk personnel, so that's why I can just go straight into entering my email and password and completing the reCAPTCHA. And again, we have the two-factor authentication for added security. So I'll go back to my front desk email and grab that verification code, pasting it in the box. And then I'll click verify. I am going to use the Jefferson Clinic for today, so I will access that portal. And now I'm in the clinic portal from the front desk point of view. So you'll notice I only have the recipient check-in tab since that is the main task of the clinic front desk personnel. The default view here is today's appointments, but this drop-down allows you to view other appointments as well, which you can see here. And I can also create a walk-in appointment if my clinic allows that. I do want to note that even walk-in recipients must be registered in Vams just to ensure that they've been validated with an employer so we know that they're eligible to get the vaccine. So when I use this create appointment button here to create a walk-in, it is going to ask me for a recipient's email. So I'm going to put in this recipient's email here and search for it. If the recipient had not registered in Vams, this would let me know that they were not yet registered. As it stands, this recipient does not have any other scheduled appointments, so I do have the option to schedule a walk-in for him at my clinic. If he had an appointment scheduled at another clinic, the system would alert me to that, and it would give me the option to either cancel his other appointment and schedule at my clinic or keep that appointment that he has at another clinic. But for today, I'm going to click schedule walk-in. And now I see that his appointment has been created successfully, and I can check him in with this QR code or back on the clinic portal homepage in the appointments table. So this is the walk-in I just created. If I go to click check-in recipient, I'll get this notification that he has not yet completed the consent form. And that would make sense since we just created his appointment. So he will have just received an email asking him to complete that form. So I would just let the recipient know to go check their email and complete that form before I can continue with his check-in. But I'm going to go ahead and check in Kim Butler since we just walked through completing her form. So I know that she's all set. So you can see I get this confirmation here that she has in fact completed her consent form. And then it's asking me to verify all of her information, double check it here and verify it against a form of identification. So if ID is required for your clinic, they will need to have a state or federal issued ID or some other valid ID. And ID requirements are based off jurisdiction policy. So those policies do vary. If ID is required, but the recipient doesn't have a valid form, I would select this option down here. And that would cause her to need to cancel her appointment and reschedule. But let's say that for now, she gave me her license, everything checks out. So I'm going to select state or federal issued ID and click next. And now she is all checked in for her appointment. So I'm going to pass it off to Jenna, who is going to log in as our healthcare professional and show how to record administering the vaccine to this recipient.
Thanks, Shelby. So I will be serving as Tybron Williams, the clinic's healthcare professional. As the healthcare professional, my homepage will only have one tab, which is Manage Appointments. From this page, my default view of this table will be today's checked-in appointments, but I can also use the checked-in recipients view to see all checked-in recipients regardless of the date. So to begin the vaccination process, my first step will be to access the recipient's record by clicking the recipient's name. The next screen that appears will ask me if I've confirmed that this is the vaccine recipient, the correct vaccine recipient. And I will do that by confirming their name and date of birth. So yes, I have confirmed that this is the correct recipient, and I'm going to click next. So now we're taken to Kim Butler's recipient record. Moving from top to bottom, the top of this record includes general information about the recipient, their name and their gender. Moving down is the notes section. The notes section of the record is where you can log information about the recipient that may be helpful to another healthcare professional in the future, such as the recipient is nervous about needles. To log a note, you will click New Note button in the upper right-hand corner of the page, and a pop-up window will appear where you can add your note. So you will type the title of the note, add the content of the note, and click Done. For now, we won't create a note in Kim's file. Moving down, we will see that the recipient has completed the vaccine questionnaire and consent form. If there was anything that Kim had reported that I, as a healthcare professional, should really pay attention to, an alert will be there as well. But Kim has not reported any such thing, so she doesn't have anything in her record that reflects that. Moving down is the information that she reported during the vaccine consent form completion. So the recipient does not feel sick today. She does have an allergy to fish, but the rest of the answers are no. Moving to recipient details, I will see information about her name, gender, ethnicity and race, their mailing address, preferred method of contact, and contact information, as well as emergency contact information if they had left that. The next tab, medical information, is the information the recipient entered upon registering in Vams, which includes any medications and health conditions, known allergies, information about their insurance company as well. Finally, the vaccine administration tab will include information about the COVID-19 vaccine history if they have received a dose prior, as well as the next dose eligibility. Information about when the recipient will be eligible for their next dose of COVID-19 vaccine is based on the recipient's last vaccine. This is where you can also view their vaccination certificate record as well. So to begin vaccination for Kim Butler, I'm going to click this button, Log Vaccination. Since you've reviewed Kim Butler's medical history and assessed her current condition, you can confirm that you can administer the vaccine and progress to the Enter Vaccine Information screen. So yes, we can administer the vaccine, and yes, the recipient has consented to receive the vaccine. You will see that you can log the vaccine information, the vial, the UOU, unit of use, either by scanning it with a 2D barcode scanner or entering it manually. Today, we're going to enter it manually. First, you will select the manufacturer. Then you will select the product from the drop-down menu. Notice that the information, once I selected manufacturer, pre-populates. The vial information is checked against inventory that exists in the system. So based on vaccine inventory data already logged in the system, the drop-down selections for the fields will be dependent on the manufacturer you select. We will select the lot number, and you'll see that the expiration date has defaulted and cannot be changed. On this screen, we will log the vaccine information where you have administered the vaccine. So we can come here and say left deltoid. We will also review this to make sure everything we have entered is correct. Here, we will log the vaccination outcome. Today, our vaccination was successful. If we had selected no, if it was not successful, The system will prompt you to determine if it's possible to reattempt the vaccination. More information about how to log an unsuccessful vaccine can be found in the Healthcare Professional User Manual. Today it was successful. This screen is asking if there was any inventory wasted during the appointment. If wasted occurred, we could click yes and log the waste. You would log the waste information by following the same process you followed to log vaccine information, either entering it manually or by scanning the vial barcode. Today, there was no waste, so we will say no. This screen will show that the recipient will be eligible for the next dose of the COVID-19 vaccine on or after November 17th. Again, the vaccine data entered in the system determines the date the recipient is eligible to receive their next dose and will not allow the recipient to book an appointment before that date. Vams will also send a notification to the recipient that includes the date they are eligible to receive their next dose, along with a link to schedule their next booked appointment on or after that date. You can inform the recipient that they can access their vaccine certificate from the Recipient Portal. You can also view the vaccination certificate by clicking the hyperlinked text here and pulling that up. And you can also show this to the recipient when you are done. So we're going to click OK. If no further doses are required, the pop-up window will state that all COVID-19 vaccine doses have been administered. This concludes my demo of the healthcare professional role in Vams and the end of this end-to-end demo.